This is the Transition Series Topics for the EMT. Topic number 2, Therapeutic Communications. Our objectives are to understand communication from a process perspective, to identify useful techniques to facilitate communication between individuals, to discuss how to improve communication with persons of differing cultural backgrounds, and to describe strategies on communicating with difficult patients. Communication is a basic EMT skill. It is an active process that incorporates verbal and nonverbal expressions into messages that are received by others. Many factors can influence how messages are sent and interpreted, such as age, gender, culture, and personal experiences. Effective communication can be used to establish a positive rapport with your patient, so you can gain valuable information essential to their care. To do this, you must be competent, confident, and compassionate. The process of communication begins when the sender or speaker creates and encodes a message based on the information he wants to convey to the receiver. For the receiver to understand the message, it must be decoded. The process of decoding can be influenced by the receiver's beliefs, perceptions, values, and cultural background. It's important that the message be decoded accurately to ensure effective communication. The receiver should provide feedback by responding to the sender, communicating what they understood from the message that was sent. Here's an image showing a person sending, a person receiving, and then providing feedback. Here are some techniques that may help you facilitate communication with your patient. You can clarify, asking more questions to clarify the patient's meaning. You can summarize, rephrase the response, and ask if this is what the patient meant. Present the information in a way that the patient can understand it. Use silence to give the patient time to form an appropriate response. Use reflection to redirect the patient's statement back to him emphatically. Use empathy to try to understand how the patient feels and how the patient has been affected. Avoid confrontation unless it's absolutely necessary, and convey respect and that you are acting in the patient's best interest. And finally, facilitation will help the patient express himself with the aid of communication devices. As an EMT, the first impression you give to the patient when you arrive on the scene provides a foundation for the rapport you will continue to develop with the patient. The rapport should be positive and help facilitate your understanding and care for the patient. You must speak and act professionally, make introductions, and learn the patient's name. Always gain consent, preferably verbal and informed consent. Limit interruptions and control the surrounding noise, and always be courteous, compassionate, and respectful. Conducting a patient interview is an important technique for an EMT to use. It's a mutually beneficial process. When the patient interview is performed effectively, both the EMT and the patient benefit from the process. The interview is used to gain valuable information about the patient's current problem and helps the EMT determine an appropriate course of action. Although much of the interview is verbal, it's important for the EMT not to overlook the nonverbal elements in communication. For example, the posture that the EMT uses to approach the patient, looking them in the eye, remaining at eye level with the patient, even if that means kneeling beside them. Use open arms and open hands to convey relaxation and a non-threatening posture. Be sure that you're aware of the distance between you and the patient. People in distress may want a bigger distance between them and other people. Ask for permission before entering your patient's personal space. May I take your blood pressure? It's usually acceptable to place a hand on a patient's shoulder or forearm. Watch for gestures. Be aware of your expression. Smiling will help the patient feel relaxed. Watch your patient's facial expressions for indications of how he or she feels. Maintain eye contact when it's appropriate. It's important early to establish eye contact, as in American culture this is a key aspect of an honest exchange. And use touch when it's appropriate to help calm the patient. It will convey compassion and empathy and help calm the patient down. Here's a picture of an EMT using eye contact, a non-threatening posture, and patient contact, physical contact with the patient's shoulder to convey comfort and focus. And clearly this EMT wants this patient to understand that he's there to help the patient. When you're interviewing the patient, consider the age and mental capability of the patient. Your understanding of that will be refined as you continue to interview them. Ask one question at a time. Start with open-ended questions like, how are you feeling? Avoid leading or biased questions. For example, if you ask, is the pain sharp or dull, the patient may feel that those are the only options. They may have actually felt more pressure than pain, but it may be harder for them to say that if you're looking for either sharp or dull. Do not interrupt or talk too much. It's important to listen to your patient. Don't give false reassurances or inappropriate advice. Content yourself with assuring the patient that you're going to take very good care of them. Do not make conjectures as to the eventual outcome of their care. There are many cultures in the United States. We are every year more and more a multicultural society. A person's cultural background will strongly affect your communications. It's important to understand that cultural differences exist, that their culture may be different from yours, and it's composed of the thoughts, communications, actions, and values of their racial, ethnic, social, or religious group. Try to learn the basic tenets of other cultures in your service area. Both the EMT and the patient bring their own personal experiences into their professional interaction. So it's really important to avoid ethnocentrism, the belief that one's own cultural group is the most important, and to respect the patient's culture. It's easier to do this if you've actually been exposed to other cultures. So seek out opportunities to learn about people who are different than you. Here's a Caucasian EMT conducting an interview with an apparently Asian family. It would be helpful if this EMT had had prior experience with that culture. Challenges in communication include family preference issues, unmotivated or hostile patients, communicating with age extremes, patients with disabilities, for example, hearing problems, and particularly non-English speaking patients. As an EMT, it's important to prepare ourselves to avoid difficult situations that may cause challenges in communication, and not to avoid them. Communication, both verbal and nonverbal, is integral to properly assessing your patient. You'll be presented with many challenges given the diversity of patients in our culture and our service areas. It's important to learn as much as you can about the other people in your service area, learn as much of their language as you can, and make every patient understand that you're there to help them. The use of techniques discussed in this chapter will greatly enhance your ability to communicate when difficulties arise.